morning, Dr. Jayashree Todkar here. In the series of treatments for obesity and the surgical treatments for obesity, we are going to today look at what are the preparations needed for this obesity surgery so that it becomes a smooth sailing for the patient and the doctor both. All obese patients do have n number of baggages of diseases like diabetes, hypertension, uric acid, kidney problems, liver problems, heart problems, lung problems, etc. along with obesity. And it is essential that when we take the patient for operation, we get the patient to the maximum best level of fitness. Almost 5 days to 3 weeks is the period needed when the optimization schedule of the patient is implemented. What do we do in the optimization schedule? Number 1, good hydration of the patient is ensured so that the detoxification happens in a very smooth way. Oxygen concentration and oxygen levels of the body to be get into the better levels by doing lot of respiratory exercises. So patients are given incentive spirometries where we make the patients do the lung exercises using the balls or the balloons so that the lung elasticity becomes better. Most of the patients who are having central obesity will have a short lung span and have not done any adequate lung exercises over years. So in this situation, it makes a lot of good impact on the post-operative recovery after anesthesia if we do the chest physiotherapy and the exercises at home in the pre-operative period. Patients are instructed to walk and do lot of leg movements in terms of adequate emptying of the vessels of the legs. This again ensures that all the toxic products which are accumulated in the legs in the stagnant vessels get naturally very nicely drained, and this helps in the patient's recovery after operation also. The liver of obese patients is usually fatty liver and is retaining a lot of edema as well as the fat. This fatty liver is a very soft organ and can be of a lot of trouble when we are operating inside during the bariatric surgery. Also, liver is an important organ for detoxification of the anesthesia medications and excretion of the toxic products after this anesthesia is given is done by the liver cells. So it is essential to have a healthy and nicely consistent liver with us before the operation and the anesthesia. For this, we give them protein shakes so that the liver becomes more healthy and more better. These are the few things which are taken care of in the pre-operative days as an optimization schedule, and you can do this optimization schedule at home while you are working without taking any kind of leave from the work. Now when the patient gets admitted a day before the operation, patient is given medications which will cleanse the intestine so that when we are operating we get soft and supple intestine, not the dilated ones. Also the patient is given anticoagulant injection, so blood thinning medicine is given 8 to 10 hours prior to the operation. Why we need to give it? This blood thinning injection is given because the patient is operated in a position which is almost 60 to 70 degrees upright. So this is the horizontal position of the patient and this is the position in which the patient is operated. When the patient is standing like this, all the blood gets accumulated in the legs and it can form clots which can give rise to multiple complications. To avoid this, the patients are given anticoagulation injections 1 day before the operation. The patient is kept nil by mouth almost for 6 to 8 hours before anesthesia. In this time, we can allow them to have some sips of water. Once the patient is taken into theatre, almost first 1 hour is anesthesia, positioning of the patient, then almost 1 hour is operation as such, and then is again the reversal of the patient and repositioning of the patient to the normal position. Altogether, patient is with us in the operation theatre for almost 3 to 4 hours. After the operation is done, patient is shifted to the recovery and observed for almost 2 to 3 hours again. In the recovery, we give patient water to drink, make the patient walk, let him pass urine, and then only we shift the patient out of the recovery to the wards. After the patient is shifted to the wards, for 24 hours, some antibiotics, some injections, and some saline is given to the patient to fasten the recovery. And after that, once all the parameters are ensured, we send the patient home. So this is almost a kind of schedule to be observed by the patient pre-operatively, and these are the things which are to be observed during the hospital stay of the patient. Once the patient is sent to home, he is given complete instructions about the recovery to be becoming smooth during this post-operative phase. In the next session, we are going to look at what are these regimes which make the operations smooth experience for the patient. Stay with us.